Hi, my name is Julie Morelli, and this is my medical terminology board game. I based it off of the cardiovascular system, so it's called In a Heartbeat. And the learning objectives of my game are to understand the essential components of the cardiovascular system and the ways in which they all interact with one another. To be able to identify the specific medical professionals who treat cardiac disabilities, to learn at least 2 new medical terminology words regarding the cardiovascular system, to learn how to properly incorporate each word into a discussion regarding a specific medical condition, and to obtain a deeper understanding of certain conditions and the specific ways to treat them. Someone can learn about medical terminology through playing my game because each term will be paired with a specific definition or meaning, and after repetitive trials of the game, the words become familiar, and thus the player will be knowledgeable in terms of cardiac medical terminology. Even if the player gets the word wrong, the word is repeated with the matching meaning, so hopefully the next time they see the word, they will recognize it. How can someone win or lose? In order to win this game, the player must complete the duration of the path from start to finish. Each question that the individual answers is worth a certain amount of points based on difficulty. However, every question answered wrong is only worth 1 space forward. The purpose of this game is to get as many medical terminology questions correct regarding the cardiovascular system in order to reach the finish spot of the board. The person who reaches the finish spot first wins, and the other will lose. First question. 3 points. Any medicine that keeps the blood from clotting.
Anticoagulant.
Correct.
How many points is that?
3. My turn.
For 2 points, the location where substances are exchanged between blood and cells.
Capillaries.
2.
Three points. Natural pacemaker of the heart.
Sinus node.
Correct.
2 points.
Yes. So because he landed on this space, he can now cross the bridge.
So for 2 spaces, within vertebrates, blood and lymph have an essential role in maintaining what?
Homeostasis.
Yes. 2 points.
An abnormal rate of muscle contractions in the heart.
Heart arrhythmia.
Correct. It's 2 points.
For 2 points, period of ventricular expansion in the heart.
Diastole. For 2 points, the narrowing of blood vessels that results from contraction of the muscular walls of vessels.
I don't know.
Vasoconstriction.
So
just
1
1
point.
Yeah.
Okay, for 3, body's disease and infection fighters.
White blood cells. For 2 points, the death of a body tissue due to lack of blood flow or serious bacterial infections, and is very prominent in diabetic patients.
I don't know.
Gangrene.
Okay, for 2, a physician specializing in diseases located in bloodstream.
Hematologist.
Yeah. 2 points.
2.
Yeah.
Two points. A group of heart muscle cells that send out specific signals to make the heart contract.
Pacemaker.
Correct.
How many was it?
2 points.
For 4, a physician that specializes in the treatment of diseases of circulatory systems.
Cardiologist. 2.
4.
A professional, this is worth 2 points. A professional who takes blood.
A vampire?
No.
I don't know.
Called a phlebotomist. Good try though.
Oh. For 2 points, the force exerted by the blood against walls of blood vessels.
Blood pressure.
Yeah, 2.
Okay, for 1 point. 2 points, sorry. Another word for hardening of or calcification of the arteries.
I don't know.
Arthrosclerosis. That's just 1 point.
For 3, the largest artery in the body.
Aortic. 2 points. Fast heart rate in comparison to normal rates.
Tachycardia?
Correct. So that's 2. Tachycardia is fast and bradycardia is slow. 2 points. Volume of blood in liters of an average
It's
adult.
your turn.
Sorry.
All right, so for 2 points, the valve located between left atrium and left ventricle.
Mitral valve.
Yeah.
Did you say 2 points?
Yeah.
Okay, this is you. Sorry. 3 points. Volume of blood in liters of an average adult.
It's 4 something. 4.7.
Yep, 4.7 to 5. Correct. So 2 points.
2. Okay, for 3, complex protein located in red blood cells.
Hemoglobin. Okay, 3 points. When the blood reaches the lungs, this is released from blood and oxygen is then absorbed.
Carbon dioxide.
Yep.
Was that 2 or 3?
3.
Okay, for 3, for 2, blood vessel that carries deoxygenated blood back to the heart.
Veins.
Yeah.
And 3 points. Slower heart rate in comparison to normal rates.
I don't know.
Bradycardia.
No.
So that's just 1.
Okay. So for 3, period of ventricular contraction.
Systole.
You win.
Okay. So mine finished first, so I ended up winning the game. So just to review our learning objectives, essentially when completing this game, one should understand the essential components of the cardiovascular system, which was reviewed. We should be able to identify the specific medical professionals who treat cardiac disabilities, which were identified throughout the game. We should be able to learn at least 2 new medical terminology words regarding the cardiovascular system. So when this player got the word wrong, I clarified the correct meaning that was identified with that specific word so he could recognize it in future reference. And lastly, obtain a deeper understanding of certain conditions and the specific ways to treat them. So specific conditions, for example, would be gangrene, which is specifically prominent in diabetics.